Only two questions concern patients when they are looking for a clinic. Let's clearly formulate them, and then we will fill the website content based on criteria whether our website answers these two questions or not. The first question: how well do you do your job? The second question is: can I afford it? Everything we do on the website is guided only by these two questions. I will not elaborate on how dental clinic websites are typically filled. There are numerous mistakes and foolishness to be found there. I will immediately inform you about how I handle it in those projects for my clients. The first thing a visitor sees on my websites is a message from the doctor where we try to relieve the stress, the patient's sense of guilt for letting the situation escalate. And I believe that empathy from the physician is the important psychological factor that helps the patient feel comfortable towards the clinic and the doctor. Not to show off, not to lecture on the importance of dental care, but to try to relieve stress, give hope, say that we have extensive experience in solving the exact problem that concerns the patient, and we will handle their situation. I'm putting this small text next to the doctor's portrait so the patient knows it's the physician's words, and they'll be taken care of by this specific doctor. Such text is always read. Next, we succinctly use icons and headings to explain how we provide quality treatment. We don't write long blocks of text. We appreciate attention and communicate with the patient concisely, briefly, informatively with illustrations. For example, on the therapy page, the focus is on pain relief, creating comfort for the patient. These are quality materials that provide long-lasting results. This is optical magnification that offers precision and focus on aesthetics because we care not just about function, but also about the beauty of the smile. Only 4 icons, 4 headings, and our patient understands how your treatment differs from other clinics. Does this screen answer the questions we formulated earlier? Yes, of course. Next is a slider with clinic photos. We visually demonstrate the environment, show the doctor's work, communication, and interaction with the patient. This immerses the website visitor in the atmosphere. They put themselves in the patient's shoes and answer for themselves whether they like it here or not. Next, you can make a commercial offer. We have already alleviated concerns and explained how we will conduct the treatment. Now we need to address the question of the amount it costs. I offer a complete solution without any ambiguous concepts. If a patient sees a price starting from 40 out of 50,000, they won't contact. They will think that for 40 it's the cheapest and worse, something additional will be needed, and my budget is limited. But if you specify that the turnkey surgical stage costs 40,000, and this price includes all components, all work, he will agree because he has this amount, and you have given him a reference point that it will be enough for him. Therefore, all the websites I create have a very well thought out and illustrated turnkey price list. Publishing a list of medical procedures on the Clay website is a frequently made error. We observe it frequently. Many clinics allow it without considering that when a person does not understand the final cost of treatment, most patients do not ask this question. They just move on, looking. After a lively turnkey PR will showcase work examples specifically on the topic concerning the patient. No need to display someone who came to learn about veins rehabilitation of toothless patients. You may be good at it, but there's no need to show off. A common mistake is to put all examples of work before and after on one page, hoping that the patient will find a case similar to theirs. No, it won't be found. It seems more reasonable to place them only on the pages they illustrate. In other words, the cases should be published on the pages of the specific medical service that was provided to this patient, which are vividly depicted.